Dapoxetine is a treatment for premature ejaculation in men 80 to 64 years old who have all of the following: ejaculation in less than 2 minutes following vaginal penetration, on most occasions with little stimulation and before the man wishes to. Marked personal distress and interpersonal difficulty as a result of premature ejaculation. Premature ejaculation troubles the man and his partner, and poor control over ejaculation. How to take Dapoxetine tablets. Before you start the treatment, read the manufacturer's printed information leaflet from inside the pack. It will give you more information about Dapoxetine, and this also provides you with a full list of the side effects, which you could experience from taking it. Take Dapoxetine exactly as your doctor tells you to. Drink a full glass of water at the same time as you take a tablet. The recommended starting dose is 1 30 mg tablet, taken 1 to 3 hours before you anticipate having sex. Your doctor may later decide to increase your dose to 160 mg tablet. Your doctor will only prescribe the high dose for you if the 30 mg dose is insufficient, and providing you have not experienced any side effects such as feeling faint. Do not take more than 1 tablet in any 24 hours. Dapoxetine is not intended for regular daily use. You should only take it before you anticipate having sex. The tablet has a bitter taste, so swallow it whole without chewing. You can take it either with or without food. Before taking Dapoxetine. Some medicines are not suitable for people with certain conditions, and sometimes a medicine can only be used if extra care is taken. For these reasons, before you start taking Dapoxetine, it is important that your doctor knows if you have a tendency to faint, if you have a heart condition, if you have a bleeding or clotting disorders, epilepsy, if you have ever had mental health problems causing high or low moods, such as bipolar disorders, depression or mania. If you have increased pressure in your eye, a condition called glaucoma. If you have any problems with the way your liver works, or if you have any problems with the way your kidney work. If you have ever had an allergic reaction to a medicine. If you have taken any other medicines, that includes any medicines which are available to buy without a prescription, as well as herbal and complementary medicines. Getting the most from your treatment. Make sure you keep your follow-on appointments with your doctor. This is so your doctor can check on your progress. Do not drink alcohol whilst taking Dapoxetine, as it might increase the sedative effect of the alcohol. It can also increase the risk of fainting. Do not use any recreational drugs while you are taking Dapoxetine, as this could lead to you experiencing serious side effects. A chemical in grapefruit juice can increase the amount of Dapoxetine in your bloodstream, and that increases the risk of side effects. If you do drink grapefruit juice, do not take a Dapoxetine tablet for at least 24 hours afterwards. Take care if you are a driver. If you feel faint or dizzy, do not drive and do not use tools or machines. If you buy any medicines, please check with your doctor or a pharmacist that they are suitable for you to take with Dapoxetine. Can Dapoxetine tablets cause problems? Along with their useful effects, most medicines can cause unwanted side effects, although not everyone experiences them. The below contains some of the most common ones associated with Dapoxetine. You will find a full list in the manufacturer information leaflet supplied with your medicine. The unwanted effects often improve as your body adjusts to the new medicine. But speak with your doctor or pharmacist if any of the following continue or become troublesome. Very common Dapoxetine side effects: feeling dizzy or lightheaded, feeling sick, nausea, sweaty or confused, headache,